We're here today to explain how and when we will get Oklahoma back open. Let me be clear. We will do this safely, responsibly, and based on the data in our state. From the beginning, it has been my attempt to do two things. Number one, protect the health and lives of Oklahomans, especially our most vulnerable population. And number two, to mitigate the impacts to Oklahoma's economy and get Oklahomans safely back to work. You might have heard me say that what we do in the month of April will greatly determine how fast we get back to work in the future. The 15 executive orders that I signed starting back on March 15th were designed to protect our hospital capacity, flatten the curve, and secure more PPE. Oklahomans, you have done a fantastic job. We have flattened our curve, and we've developed a plan to increase the hospital surge capacity, and we have made tremendous progress on PPE. The White House guidelines have four main gates that we had to get through before we could start opening up our economy. I want to show you some graphs on how we're doing on each one of them. One of the gates is treating all patients without crisis care in our hospitals. Our total hospitalizations peaked at 560 back on March 30th and has continued to then trend down for the entire month of April. To be clear, the graph is tracking people in the hospital with confirmed COVID-19 or people in the hospital that are being treated for COVID-like symptoms. We currently have 298 people in hospitals for COVID across our state, but we have more than 15 times those amount of beds available across our state. Gate number two, as designed by the White House, is a downward trajectory of documented cases, and our new cases are continuing to decline. Daily reporting varies because of testing on the weekends, so we track these on a 7-day rolling average. You can see how these are trending down. These numbers are trending down even as we continue to test more and more people across our state. The White House also has two other gates. We are tracking them as well. Influenza-like illnesses and COVID-like syndromic cases are also in the downward trend. As I mentioned before, we will use data to make decisions on when and how to safely reopen responsibly. Our plan to open up and recover safely includes a significant focus on testing and tracing. We know that this virus will continue to be around for a long time. We are not out of the woods yet. This virus is still in the United States. It's still in Oklahoma. People will still come in contact with this virus. That is why social distancing and taking precautions like wearing a mask is still really important as we continue to take a measured approach. Enhanced testing and tracing allows us to better respond to people who get sick and quickly identify who needs to be isolated so we can control the spread of the virus. I want to be clear, when it comes to reopening our economy, protecting the health of Oklahomans remains my top priority.